Hello everyone, welcome back to our NABH training series. Today we will discuss IPC.3, which is one of the most critical and practical standards in infection control. Let me tell you clearly, IPC1 is about planning, IPC2 is about resources, but IPC3 is about actual implementation on the floor. And during NABH assessment, assessors will not just see documents, they will observe practices in real time. In this session, I will explain each objective element in detail, what assessors actually check in wards, ICU, OT, practical hospital implementation, common non-conformities and exact closure. Let's begin. Standard overview. IPC3 states, the organization implements infection prevention and control processes in clinical areas. Simplified understanding. Policies must be implemented on the ground, staff must adhere to them, regular monitoring should be conducted. This is about practice, compliance, monitoring. Standard precautions, foundation of IPC. Let's start with the most important, core element. Standard precautions must be followed at all times. What are standard precautions? These are basic infection control practices applied to all patients. Components include hand hygiene, PPE usage, respiratory etiquette, safe injection practices, sterilization of instruments, environmental cleaning, sharps injury prevention. Also includes skin preparation before procedures, use of sterile equipment, implementation, SOP in all departments, staff training, checklists, assessor observation, nurse not wearing gloves during procedure, major NC, standard precautions are non-negotiable. Hand hygiene compliance. Next, another core element. Organization must follow hand hygiene guidelines. Reference: WHO Hand Hygiene Guidelines, 2009. WHO 5 moments. Before touching patient, before procedure, after body fluid exposure, after touching patient, after touching surroundings. Implementation, display posters near wash areas, hand rub availability, regular audits, assessor check. They may ask staff, what are 5 moments? Staff not aware is NC. Transmission-based precautions. Next, transmission-based precautions. Additional precautions based on infection type. Types: contact precautions, droplet precautions, airborne precautions. Implementation: identify patient condition, use appropriate PPE. Examples: TB, airborne, N95 mask, COVID. Droplet or airborne, MRSA, contact precautions. Example: patient with TB but no mask used is NC, correct PPE selection is critical. Safe injection or infusion practices. Next, safe injection practices. 1 needle, 1 syringe, 1 time. Key principles: no reuse of needles, no reuse of syringes, proper disposal. Use sterile equipment, aseptic technique. Reference: WHO Injection Safety Guidelines. Example: using same syringe for multiple patients, serious violation. This is a zero tolerance area. Antimicrobial usage policy. Next, very advanced and important. Hospital must have antimicrobial policy. What should policy include? When to use antibiotics, which antibiotic to use, dose and duration, escalation or their escalation, based on antibiogram data, additional requirements, restricted antibiotics list, WHO aware classification, monitoring, culture sensitivity reports. Example: doctor prescribing antibiotics randomly is NC, policy must guide treatment. Antimicrobial stewardship program, final core element, very critical. Hospital must implement antimicrobial stewardship program. What is AMSP? System to ensure rational antibiotic use, prevention of resistance. Components: leadership commitment, accountability, drug expertise, monitoring, reporting, education. Implementation: approval system for restricted drugs, audit of prescriptions, feedback to doctors, AMSP committee, clinicians involved. Example: no monitoring of antibiotic use is NC. AMR, antimicrobial resistance, is a global concern. Common NABH, NONCONFORMITIES, NC1. Standard precautions not followed. Closure, training, daily monitoring. NC2. Poor hand hygiene compliance. Closure, hand hygiene audits, display posters. NC3. Wrong PPE usage. Closure, training, visual guides. NC4. Unsafe injection practices. Closure, strict SOP, monitoring. NC5. No antimicrobial policy. Closure, develop policy, Annual Review. NC6, No AMSP Implementation. Closure, Form AMSP Committee, Track Usage. NC7, Staff Not Aware. Closure, Regular Training, Competency Checks. Final summary. To summarize, IPC3 is about actual implementation in clinical areas. Focus areas: standard precautions, hand hygiene, PPE, injection safety, antibiotic control. If IPC3 is strong, infection rates reduce, patient safety improves, NABH compliance becomes strong. In the next video of this NABH training series, we will discuss IPC4, the organization implements infection prevention and control processes in support services. If you found this session useful, like the video, share with your colleagues, subscribe for more NABH training sessions. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.